Cancer research is an investment. It's an investment in the human life, in health, and in the future. And it is a powerful way to make a difference in this devastating disease. Funding save lives through the new treatments, early detection. Funding for cancer research improves the quality of life. Learning about the ways to minimize side effects and coming up with targeted treatment. Funding for research affects prevention and risk reduction, identifying those risk factors and helping improve lifestyle and developing what's hot now are those vaccines. And then there is the importance of that global impact. Funding support international collaboration, accelerating the progress in cancer research. And that is the point of it all. I was first diagnosed in 2008, early stage hormone receptor positive, and then again in 2014. But my entree into the breast cancer diagnosis began much earlier than that, in that as a little girl around the age of 5 is when I first heard the word cancer. And that was when my paternal aunt was very sick and dying of breast cancer. But since then, my mom has had breast cancer, a maternal aunt, and 5 sisters have had breast cancer. That's why research is so important to me. And if I may give you a little example, when I was first diagnosed in 2008, the Oncotype DX testing was on a trial basis. And so, had I been, because of that research and that advancement, when I had my recurrence in 2014, I received that Oncotype DX testing, which indicated that I would benefit from chemotherapy. So that's just a small snippet of the many things that have happened in this short period of time since I was first diagnosed, all thanks to research. Participating in science-driven clinical trials benefits everyone. It advances the knowledge with new treatment and improvement of existing treatment. It advances the understanding of the disease. But then there are the potential personal benefits for the patients, which includes early access, opportunity to receive new treatments before they're widely available, and benefiting from those advantages. Well, the challenges facing minorities are very well documented, and they also are very complex. Some of them include lack of access to quality health care, uh, limited access to preventive screening like mammograms, also difficulty finding doctors who are culturally competent and understand the specific needs of the population. And of course, those are the financial barriers to accessing treatment. And then there are biological differences and discrimination and bias. Minority women face discrimination in healthcare systems, leading to the disparities of care. Implicit bias among healthcare providers can influence the treatment decisions. Then you look at the socioeconomic factors. Poverty, lack of education can contribute to delayed diagnosis and also limited access. Then the stress and other psychosocial factors can impact health outcomes. But if I may, I want to also say that the same factors that can contribute to the challenges facing diagnosis and treatment, those challenges also limit access to that all-important clinical research. The importance, again, of those patient-centered trials, trials that are most important to the lives of patients, be it, and the research, be it basic, clinical, or translational. Though I would express the need and the urgency from a patient for those trials. You know, sometimes when diagnosed with cancer, you can feel helpless. But just knowing that there is something that I can do, not only for myself and for my family, but for the broader breast cancer community is so rewarding.